Hi, it's Angela, your nurse. Do you remember me? That's okay. You've had a little bit of a head injury, okay? I'm here just to check you out. Okay. How are you feeling? Has the drugs worked for your headache? A little bit? Okay, that's good. Okay. I'm just gonna have a look at your head, okay? I might need to change that wound on you. And then I'm just going to do a little bit of a examination, mostly neurological, just to make sure that we've had no changes in the past 24 hours. Okay? Good. Have you had breakfast? Okay. We do a pretty good breakfast here for hospital, so you should definitely try it. Okay, so don't mind me with taking some notes down. We're just focus on yourself at the moment. Okay, so I'm just gonna have a look at that wound. Okay, it was pretty nasty wound last time I had a look. Just gonna take it off here. Okay, so it's just held by the little tissue. So it does need a little bit of a wash, so we'll just do that right now. Okay, just gonna pour some water. Okay, just wanna nice and moist. Okay, so if you hold still, if it does hurt, let me know. Okay, so I'm just going to just dab, dab, dab. Okay, and dab, dab, dab. Okay, good. Here, we're just going to dab, dab, dab. Okay, and again, dab, dab, dab. Okay, all right, so that looks a little bit cleaner now. We're just going to apply a dressing on. So I'll just pop on my gloves. And how's your memory? Do you know what day it is today? Good. And do you know what date? Okay, that's good. All right, so I'm just going to unwrap our little bandage first. Got a fresh. Okay, and then we just have our gauze. Okay, so if you just stay still for me, okay, I'm just gonna place this up on here. Okay, good. And sorry, can I just get you just to hold it for me? Okay. Thank you. And I'm just going to start wrapping this around. Okay. Perfect. Okay, good. And if you can just hold it there for me. Perfect. And I'm just going to place some tape up there. So, okay, just place it here. Okay, and I'll just get another one. Okay, just place that one on here. Okay, good. How does that feel? A little bit cleaner, a little bit better. That's good. Okay, so I'm sorry, I'm just gonna write here that we have changed your gauze. Okay, good, thank you. Sorry, just check what time it is. Okay, perfect. All right, so I'm just gonna have a general look, have a bit of a health examination now, okay? Just to make sure that nothing's changed in, as I said before, the past 24 hours. So I'm just gonna feel around your face first, okay? So I'm just gonna feel around here. Okay. Okay, and how does that feel? Okay, I just want to softly do this. Don't want to put too much pressure here. Just feeling underneath your jaw here, just to feel the muscles all around here. Okay. Okay, good. And I'm just going to palpate around your eyes. So, palpating, just feeling around here. Have you had any trouble with your eyesight? Bit blurry when it first happened. Okay, that's fine. That's that can happen. Just got to be careful with head injuries because if we hit our heads or wobble our heads a lot, it moves the brain around. And obviously if we do get an injury, we've only got a small amount of space where the brain can swell up, and if not, it can cause internal bleeding and things like that. Okay, which isn't in your case. You just have a little bit of a head wound, and I think maybe a little bit of concussion, so it's important that we do these tests in case anything has changed. Okay, good. So I'm gonna have a look at your eyes, okay? And just might pop on some new gloves. Okay, I'll be back in just a moment. Okay. All right. So I'm going to test you with a couple of things. Okay, so what I would like you to do is I'd like you to follow my finger, and if you can just stay still, okay? So just move your eyes only. Okay. Good. Great. Okay, and I'm just going to go around in a circle. Okay, good. Now I want you to just look at the man behind on the poster. Okay, and when I tell you to switch, I want you to switch your focus to my finger. Okay? Okay, so just have a look at the man over there. And switch to my finger. Okay, good. And just on the other side now, I want you to, sorry, I kind of blocked your way of the man, but if you just look just behind my head here. Okay, good. And switch. Perfect. Good. So I'm just gonna go, so if you can just follow my finger. So we're gonna go in, 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 in. Okay, made you cross-eyed, that's good. And out, 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 out. And all the way back in again. In. And all the way back out. Out, 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 out. Good, perfect. So if you can please close one of your eyes for me. Just place your hand just over there. Okay, good. And if you can tell me how many fingers I'm holding up. Okay. Good. Great. Okay. Okay, good. And just swap on the other eye there. Perfect. Okay. Perfect. You're doing a good job. Good. Perfect. Thank you. So, just to test your memory, I'm just gonna say 3 words and I'm gonna ask you them in another 5 minutes. Okay? So we've got wine, banana, and chocolate. Okay, so can you repeat those for me? Good. So I'll ask you again in another 5 minutes. Okay? So what I'm going to do now is I'm going to have a look inside your eyes. Okay, so what I'd like to do first is I'd like to check what size your pupils are. Okay, so it's just a little, this just helps me a little bit to gauge which one. So I'll get you just to look straight ahead again for me. Okay, good. And I'm going to test it without placing the light in first. Okay, so got about a 5. Okay, and just on the other side, just look straight ahead for me again. Okay. Okay, so it's roughly the same in that section too. Okay, so just right. So I'm just going to check with the light now. Okay, so if it gets too bright, please let me know. So just keep looking straight ahead for me. Okay. Okay. So when your eye on this side, it goes a lot smaller, constricts. It dilates. So you've got about two here, and just on this side. Good. Okay, and just keep your eyes open for me. Perfect. Okay, so we've got a 2 there. Perfect. So what I'd like you to do is I'd like you to follow the light now, keeping your head straight, okay, just like before. And we're just going to, we may do this a little bit quicker. Okay. Good. Good. I'm going to go in and I'm gonna go out. So keep following. And we're gonna go in and back out. Good. I'm gonna come a little bit closer now, okay? And I might actually use a different light for this. So I'm gonna use a thing called a otoscope. It's a little bit brighter. It's just got a bit of a bright light at the end of it, and it's also got a magnifying glass here. Just lets me have a look more deeper into your eyes. So let's have a look here. Okay, so I'll get you just to look straight ahead for me again, and I'm just going to come a little bit closer and have a look here. Okay, good. I can see right inside your eye. Doesn't look like there's any damage in there. Okay. Okay, good. Perfect. Thank you. And just on the other side. Okay. I'm just having a look. Good. Okay, so that looks more or less the same. Perfect. Sorry, I'll just get you just to leave your eyes open a little bit longer. Okay, good. Perfect. Thank you very much. Okay, so I'm going to pull your eyelids down, okay? So just on one side, and I want you to look in the direction that I ask you to. Okay, so just pull this one down here. Okay, so I want you to look up for me. Okay. Okay, good. And look down for me. Right. Perfect. And look to the side. Okay, good. And look to the other side. Okay, great. Perfect. And I'll just come over to the other side now. And we'll have a look there. So if you can just look up for me. Okay. And look down for me. Okay, good. Look to the right. Okay. And look to the left. Okay. Perfect. That's good. Thank you. Okay, so your eyes are looking good and they're responding to the light very well, and your movement around your eyes isn't delayed, so that's even better. Now, I just want to check out how your eyesight is. This is called a Snellen chart, okay? And I'm just going to show you it here. What I want you to do is I want you to start from the top and work your way all the way down to the bottom, okay? If you get stuck, it's completely fine, just keep carrying on, okay? So, if you can please start from the very first letter. Okay, good. Perfect. Okay, wonderful. You're doing a really good job here. Okay, good. Perfect. All right. That's okay. Just try your best. Okay. And I'm just going to come a little bit further back, and I just want you to read the numbers down here if you can. Okay, good. Perfect. And if you can go backwards. Okay. Can you let me know what this letter is here? Okay. And what about this one here? Good. This one here? Perfect. And just the top one? Good. And if you can just read this one here. A little bit more difficult? Okay, what if I just come a little bit closer? And here? Okay, great. Thank you. That looks perfect. Okay, so I'm just going to get you just to open up your mouth for me. Just going to make sure there's no blood or anything running at the back of your throat. Okay, so I'm just going to use this tongue depressor right here. It's even got a little smiley tip on it. It's usually for the kids, but I kind of like it too. So I'll get you just open up your mouth. Okay. And we'll have a look here. Okay. Good. See. Okay, so I see no lesions. Okay. Good. There's no ulcers. There's no redness I can see there. Okay. Good. And if you can go, ah. Perfect. Thank you. Okay, that's looking good. Thank you. Now if you can just open up your mouth again for me. Okay, and I want you to lift up your tongue. Good. I'm just gonna have a look very quickly. Okay, and lift it straight up. Okay, just gonna have a look. Right, perfect. Thank you. I'm just gonna do a little bit of facial expressions now. A little bit silly, but this is something that we have to do. So if you can just give me a really big smile. Good. Show me all your teeth. Okay, that looks good. And if you can please puff out your cheeks. Okay, now as you've puffed out your cheeks, I'm going to gently press on them. Don't let them deflate. Okay, so press, press, press. Okay, good. And if you can look sad for me. We'll stop that one. Don't want to do that one for too long. Want to be happy. If you can raise your eyebrows as high as possible. Good. And if you can frown. Okay. Perfect. Wonderful. Thank you. I'm just going to have a look at your ears now. Okay. But the first thing that I want to ask you is what those 3 words were that I told you to remember. Okay, you don't have to say them in the same order, it's fine. Okay, so banana, chocolate, and wine. Good, perfect. Thank you. So I'm just gonna have a look using this device again, but I'm gonna use it. Just give me a second. I'm going to use a specula on here. Okay, so I'm just going to come around to the side and we're just going to have a little bit of a look here. So I'm just going in. Okay, and I'm having just a really good look here. You can see your eardrum. Oh, wax is pretty good in there. There's no blockage. Okay, good. And just on the other side now. Okay, so I'm just gonna come over and have a look. again. A little bit more wax in this one, but it's fine. It's not impacted. Okay, good. Thank you. We'll just pop that in the bin here. Okay, so I'm just going to palpate around your ears now. Okay. And how does that feel? Any tenderness? No? Okay, good. Have you had any fullness? You're feeling that you can't hear properly since the head injury? Okay. Okay, good. Just gonna come a little bit closer here. Okay, good. And just on the other side. Okay, I'm just going to. Good. No pain, no pressure. What about when I tug on here? Feels fine. And it feels fine. Great. Okay. Can you hear this? You can? Good. And what about here? Good. Perfect. Okay, what about this? Can you feel this? Good. And it feels okay? Okay, perfect. Now I just have a tuning fork here. I'm just going to test your hearing with it. Okay, so if you can close your eyes for me, and can you point to which ear that you can hear this in? Okay, good. And you can still hear it? What about now? It's gone. Okay, and we'll just test it with this one. So keep your eyes closed. Okay, good. Perfect. Okay. And can you hear it in both ears? Good. And I'm just going to place it on top of your head as well. Okay. And you can hear that? Good. Perfect. Thank you. The last thing I want to do with your ears, I just want to listen I just want you to listen to what I say, okay? And just repeat after me. Okay, so 1, 5, 9, 11, 6, 0. Okay, heard that? Okay, perfect. And just on the other side, we've got 5, 12, 14, 19, 20, 2, 7. Okay, good. Perfect. All right, so I'm just going to have a quick listen to your heart, okay? Okay, so I want you to take a nice deep breath in for me. I'm just going to lift up your shirt. Good. And I'll get you just to take in some deep breaths. Okay, good. Perfect. And just breathe normally as well. Good. And here. Perfect. And just here. Okay. Good. Thank you. All right. So the last thing that I would like to do is I just want to check your blood pressure. Make sure that that isn't going down. Okay, good. All right, so do you have a preference on which arm? Okay, either? All right, so I'm just gonna take this out and just going to perfect. And I'll just get your arm here. Okay, perfect. I'll just undo this here. Okay, so I'm just going to all right. Good. All right, and just a little bit more. Might just feel a little bit more tightness. I'm sorry. Okay. Good. Thank you. Just take this clip off your arm. Okay, wonderful. So that's reading perfectly. Okay, just going to. All right. Wow. Everything's looking good. I'll give these notes to the doctors. Okay. You're still going to be in here just a little bit longer. We just need to make sure that nothing changes, especially when you have a little bit of a concussion. Okay. But if you need me, you have the push button on your remote there. Okay. If there's anything that you need, please don't hesitate to press it. Okay. If there's any water, or if you need help to go to the bathroom. Okay. Okay, great. Okay, patient. Well, I will let you be, and I will let you get some rest. Okay? All right, I'll see you soon. Okay then. Bye.